We've all heard the term eating disorder. Today on Doc Saying Stuff, we're gonna go into binge eating disorder. So let's talk. Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. In severe cases, eating disorders cause serious health consequences. Binge eating disorder is recurrent episodes of binge eating. Binge eating is eating in a discrete period of time, for example, within any 2-hour period, an amount of food that is definitely larger than most people would eat in a similar period of time under similar circumstances. A sense of lack of control over eating during the episode, for example, a feeling that one cannot stop eating or control what or how much one is eating. The episodes are associated with 3 or more of the following: eating much more rapidly than normal, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling of embarrassment by how much one is eating, feeling disgusted with oneself, depressed, or very guilty afterwards, marked distress regarding binge eating is present, and the binge eating occurs on average at least once a week for 3 months. In the United States, the prevalence of binge eating disorder is 2.6%. It's typically first diagnosed in young adulthood, mid to late 20s. As you've probably guessed, it's very hard to understand how much a patient is eating. There is detection bias because the clinician must make the distinction between objective and subjective binge eating episodes without clear metrics. The clinical gold standard to diagnose is the interview. Structured clinical interview for DSM disorders, the eating disorder examination, and the structured interview for anorexic and bulimic syndromes are the most widely accepted interview methods. Once someone is diagnosed, treatment can be tricky. There are various approaches, but we tend to target the core behavioral and psychological features. We target metabolic health and mood regulation. Psychological and behavioral approaches include cognitive behavioral therapy and interpersonal psychotherapy. There is one medicine that has an FDA indication for binge eating disorder. This medicine is called lisdexamfetamine. It's a stimulant. These medicines increase the amount of dopamine and norepinephrine available in nerve synapses. One of the side effects is loss of appetite, as dopamine has some responsibility telling your body you are full. This is likely why it works with binge eating disorder. If you feel you have binge eating disorder, please inform someone like me, a primary practitioner of some kind, so you may receive the help you need to conquer the habit. We're here to help you. Thanks for joining Doc Saying Stuff.